What if I shared a secret with you that could transform your blood sugar management, and it doesn't involve a pill bottle, but rather the way you consume water? It might sound overly simplistic, but the truth is that the strategic timing of your hydration can boost your insulin sensitivity by as much as 40%. I'm Dr. Samuel Cross, and I have witnessed this single habit make a monumental difference for hundreds of my patients. People who were eating the right foods and staying active, but still found themselves losing the battle against their glucose meters. As we cross the age of 60, our bodies undergo a natural shift. Cells become more resistant to the signals of insulin, and the kidneys lose some of their muscle when it comes to filtering out excess sugar. But here's the most dangerous part. Your brain's internal thirst alarm begins to grow quiet as you age. You can be walking around in a state of severe dehydration without ever feeling a dry mouth or a craving for a drink. I want to be very clear. This isn't a suggestion to throw away your prescriptions. Instead, it is about providing your body with the fundamental biological support it needs to allow those medications and your own organs to work at peak efficiency. The magic isn't just found in the volume of water you gulp down. It is found in the meticulous, strategic timing of when that water enters your system. Stick with me, because I'm going to break down the exact steps to mastering this habit so you can enjoy lower numbers and a surge of new energy. Did you know that drinking water at specific intervals can improve how your body handles insulin by nearly half? Once you hit your golden years, your pancreas doesn't always pump out insulin as vigorously as it once did, and your cells don't listen to it as well. Because your thirst mechanism is fading, you might be dangerously low on fuel without even knowing it. Even a minor drop in hydration can cause your blood sugar to climb by 15 points. That small shift is often the difference between being in the green zone and being in a state of poor control. Take my patient Gerald, for example. Gerald was a model patient. He followed his diet to the letter, he walked every day, and he never missed a dose of his medicine. Yet, his A1C numbers kept creeping up. When we looked closer, we found the missing piece. Gerald wasn't drinking a single drop of plain water in the morning. He would wake up and go straight for the coffee, then spend another hour or two active before finally having a drink. This meant his body was spending 9 straight hours in a state of progressive dehydration. Before I reveal the H3 method that helped Gerald and so many others, we need to address the 3 most common hydration mistakes I see in my clinic. Chances are, you are doing at least one of these right now. Mistake number 1, waiting until you're thirsty to drink. Thirst is not an early warning system, it is an emergency siren. By the time your brain tells you that you need water, you are already significantly dehydrated. At that point, your blood has thickened, your glucose has climbed, and your insulin is already struggling to do its job. Think of your blood like a river that carries sugar, glucose, to your cells for energy. When the river is deep and flowing quickly, the sugar reaches its destination easily. But when the river runs low due to dehydration, the water becomes thick, sluggish, and slow-moving. The sugar gets stuck in the riverbed, your bloodstream, instead of feeding your hungry cells that desperately need that glucose for energy. Mistake number 2 is drinking large amounts of water all at once. Some people go many hours without a single drop and then try to fix it by chugging a giant 32-ounce bottle in one sitting. This doesn't work for your biology. Your body can only absorb about 1 cup, or roughly 200 to 250 milliliters of water every 15 minutes. Anything you drink beyond that capacity goes straight to your bladder without ever reaching your cells. It's exactly like watering a dry houseplant. If you dump a bucket on it, the water just runs off the sides and the roots stay dry. To truly hydrate the plant, you must pour slowly so the soil can soak it up. The same applies to your body. Slow and steady wins the race when it comes to cellular hydration. Mistake number 3 is drinking ice-cold water, especially first thing in the morning or right before your meals. I know a glass of ice-cold water feels great on a hot afternoon, but it's actually a hindrance to your metabolism. Cold water causes your blood vessels to clamp down and narrow. When your vessels are tight, Insulin has a much harder time traveling through your system to reach the cells. Keeping your water at room temperature or slightly warm keeps your pipes open and relaxed, allowing for much better circulation and work from your insulin. This is particularly vital in the morning and around mealtimes when your body is hard at work processing glucose. Now, let me teach you the specific system I use with my patients. I call it the H3 method. The H stands for hydration. The first 3 represents the 3 vital times to drink throughout your day. The second 3 represents the 3 essential elements that make the water work for you. Let's start with the timing points. Timing point number 1, first thing in the morning. This is your single most important timing point of the entire day. The moment you wake up, before coffee, before breakfast, before checking your phone, or doing anything else, drink 1 full glass of warm water. Aim for about 350 milliliters or 12 ounces. Here is the key addition. Add a tiny pinch of natural sea salt. I mean genuinely tiny, just what fits on the tip of a butter knife. Then, squeeze in the juice from about half of a fresh lemon. Why these specific additions? After 8 full hours of sleep, your body isn't just dehydrated from lack of water. You've also lost electrolytes through normal nighttime processes. That small amount of sea salt provides sodium, potassium, and magnesium that actually help your cells grab the water instead of it just passing through. The lemon provides vitamin C and helps stabilize how your body reacts to the sugar in your first meal. This simple ritual also signals your adrenal glands to relax. These glands produce cortisol, your stress hormone, which naturally peaks every morning. Cortisol instructs your liver to release stored glucose into your blood. By calming this stress response with proper hydration and minerals, you prevent that unnecessary morning blood sugar spike. Take Elizabeth, a 72-year-old who had been managing type 2 diabetes for 14 years. Her biggest frustration was her morning blood sugar. She would wake up consistently at 165 or 175, even if she had a perfect measured dinner. We started her on the warm water, salt, and lemon routine at least 20 minutes before her coffee. Within 3 weeks, her average morning reading had dropped to 128. She didn't change her medication or her evening routine. She told me she felt more clear-headed and less foggy. That lower morning number gave her the confidence and momentum she needed for the entire day ahead. Timing point number 2 is before meals. About 15 minutes before you sit down for lunch or dinner, drink a smaller glass of water, about 1 cup. This simple habit does something physiologically important. It prepares your entire digestive system and stimulates enzyme production. Most importantly for blood sugar, it slightly dilutes the contents of your stomach, which directly slows down how rapidly carbohydrates are absorbed into your bloodstream. When carbohydrates enter your system slowly and gradually, instead of in a sudden rush, your available insulin can actually keep up with the demand. Your blood sugar rises gently instead of spiking dramatically. Clinical studies have shown this simple habit can reduce post-meal spikes by up to 20%. That is often the difference between struggling and maintaining good management. Timing point number 3 is during physical activity. If you are walking, gardening, doing chores, or any sustained movement for more than 20 minutes, you must drink water during that activity. Don't wait until you are finished and already depleted. Aim for small, frequent sips rather than large gulps. This keeps your blood volume stable and prevents the sugar fluctuations that commonly occur with physical exertion in people with diabetes. Consistent hydration ensures that your body doesn't view the exercise as a stressor that triggers a glucose release. Now let me explain the 3 essential elements, the second 3 in the H3 method. Element number 1, temperature matters. Room temperature or slightly warm water is optimal, around 22 to 24 degrees Celsius, or 72 to 75 degrees Fahrenheit. Cold water isn't necessarily bad, but warm water keeps your blood vessels naturally relaxed and open, allowing dramatically better insulin circulation. It is a small difference that makes a massive impact over time. Element number 2, minerals matter. Pure, filtered water without minerals isn't enough. Your cells require minerals to actually use the water. That tiny pinch of sea salt provides those essential minerals like sodium, potassium, and magnesium in a proper balance. Avoid regular table salt. It's been stripped of these trace minerals. Choose unrefined sea salt or Himalayan pink salt instead. Element number 3. Consistency matters profoundly. Your body thrives on a predictable routine. Drinking water at the same times every day helps regulate your entire metabolic system and stabilize blood sugar patterns over time. There is one more addition I consistently recommend for my patients. About 1 hour before bed, drink one final glass of warm water with about 200 milligrams of magnesium citrate or magnesium glycinate dissolved into it. Magnesium is absolutely crucial for proper insulin function, and the vast majority of people over 60 are clinically deficient. Taking it before sleep serves a dual purpose. It helps your muscles relax for deeper, more restorative sleep, and it keeps your blood sugar significantly more stable throughout the entire night. Everyone asks me this exact question. Doctor, precisely how much water should I actually be drinking each day? Here is a simple, practical formula you can use. Take your current body weight in pounds and divide that number by 2. That resulting number in ounces represents your baseline daily water requirement. For example, if you weigh 160 pounds, you need approximately 80 ounces daily, which is about 10 standard cups. If you exercise or are in the heat, add 1 additional cup for every 20 minutes of exposure. How do you know if you're drinking enough? Look at your urine color. It should be pale yellow, similar to lemonade. If it's completely clear, you are overhydrated. If it's dark yellow or amber, you are dehydrated. Pale yellow is the optimal target. To implement this, I suggest a simple strategy. Get a reusable water bottle that holds about 24 ounces. Fill it completely 3 times throughout the day, morning, midday, and afternoon. That gives you 72 ounces, which is perfect for most adults. Keep that bottle visible on your kitchen counter, your desk, or in your car. Visual reminders work far better than just trying to remember on your own. So, what actually happens when you begin this method? What should you realistically expect? In the first week, you'll probably feel like you're running to the bathroom constantly. This is completely normal and expected as your body adjusts. This usually settles down by week 2. You should notice your morning blood sugar beginning to stabilize, maybe 10 to 15 points lower on average. By week 3, you should experience noticeably more stable energy throughout the entire day, with fewer afternoon crashes. Your post-meal readings will become more predictable. By week 4, if you check your A1C, you might see it beginning to trend in the right direction. Most importantly, my patients tell me they just feel genuinely better, more like their old selves. That is the power of proper hydration. It doesn't cure diabetes, but it helps your body work the way it was designed to. Let me be absolutely clear about something critical. This is not a replacement for proper medical care. If you're currently taking diabetes medication, do not stop. If your doctor has you following a specific management plan, continue following it faithfully. What this hydration method does is support your existing medication, making it work significantly more efficiently within your body. I've had patients who, after 3 consistent months, were able to reduce medication dosages under their doctor's careful supervision. This happened because their body's entire metabolic system started functioning more optimally, not because water replaced medicine. If you have any degree of kidney disease, you must talk directly with your physician before substantially increasing water intake. For most people, this approach is completely safe, but if your kidneys aren't filtering properly, you need individualized professional guidance. Also, if you're taking blood pressure medication, pay close attention. Proper hydration can naturally lower blood pressure, which is good, but might require dosage adjustments. Watch for any dizziness and report it to your doctor immediately. Let me tell you about Dorothy, who was 74 when we first met. Dorothy had been managing diabetes for 19 years, with various medications and diets. She was an expert at carbohydrate counting, but her A1C had been steadily creeping upward to 8.6. Her doctor was talking about starting insulin. "I feel like I've completely failed," she told me. Her hydration was terrible, maybe 3 small glasses of water a day. She drank coffee and tea, but almost no plain water. "I never feel thirsty," she explained, "and I hate constantly using the bathroom." We started the H3 method together. Yes, for the first week, she needed the bathroom more often, but her body adjusted. 6 weeks later, she looked noticeably younger. Her eyes were brighter, and her skin looked healthier. "My numbers have been the absolute best they've been in 5 years," she said, showing me her log. Her average had dropped from 200 down to 150. Her doctor reduced her medication. But she said it was more than just the numbers. She had genuine energy again, and even started gardening after giving it up 2 years prior. Her A1C eventually dropped to 7.3. She told me through happy tears, "I just wish someone had explained this to me 19 years ago." Dorothy's story is exactly why I create these guides. There are thousands of people exactly like her, trying so hard and feeling defeated when the answer is simpler than they imagined. I want to challenge you personally to try this approach for 14 days, just 2 weeks. Follow the H3 method exactly. Morning water with salt and lemon. Water 15 minutes before lunch and dinner. Consistent sips throughout the day. Magnesium water before bed. Track your blood sugar and pay attention to how you feel. If you see improvement, keep going. Make this your new normal. Please leave a comment and tell me what you noticed. Your story might be what someone else needs to hear to try this themselves. If you made it all the way to the end of this script, please type "I watched till the end" in the comments. It helps me know this message is reaching the people who need it. Tell me, are you going to try the H3 method? What is your biggest struggle with staying hydrated? I read every single message. Share this with someone who is struggling, a parent, a spouse, or a friend. Hit that subscribe button so you don't miss future videos on living well and improving your metabolic health. Thank you for being here and taking your health seriously. Remember, small strategic changes implemented consistently create genuinely measurable results. Take care of yourself. I'm Dr. Samuel Cross, and I'll see you in the next one.